African Americans are living longer. Deaths have declined by 25% over the last 17 years. Rates of heart disease, high blood pressure, diabetes, and stroke are much higher among the African American population than our counterparts. They're even showing up earlier in our younger adults. Why, one may ask? So many factors within the African American community are here that affect health. Those include genetics, cultural predispositions, economics, unemployment, diet and lifestyle behaviors, even the lack of resources and healthcare settings in some zip codes. African Americans are less likely to see their primary care providers and thus less likely to have the necessary screening prevention measures. These are some barriers that have been around for years and years. They have placed institutional barriers to the adequate healthcare system within the African American communities. Also, economic and cultural factors have also played a role. When you have disenfranchised, poor population, their focus is on going to work, making ends meet, putting food on the table, and instead sometimes don't have the time to take off and go see their healthcare provider. Also, there's a certain amount of distrust in the medical field within the African American community as well. You're more likely to trust someone, believe someone, take advice from someone who you can connect to, and there aren't many African American physicians in the medical field, so patients don't feel as connected with their providers. These are all obstacles that we've faced for years and years, numerous years, but still we have to get involved. We have to take action. We have to do the right thing, take charge of our own health, and follow up with our primary care providers. After all, primary care is the initial gateway for health and wellness. It is important that we follow with our primary care providers who have broad medical knowledge bases. They're able to treat all ages, treat all genders. They're able to take care of you with your acute and chronic conditions as well. It's so important that we're able to follow up with them, get the referrals that we need to see specialists, and also follow up for that continuity of care. Your primary care provider is your advocate. They're there to keep you involved, to help you, to keep you informed, and increase your literacy of your own health care. With that being said, patients can achieve their highest level of wellness through preventative care and routine screening. With that being said, prostate care screening is one that we should all keep a lookout for. African American men are the hardest hit by prostate cancer. African American men are 1.6 times more likely to get the diagnosis, and they're twice as more likely to die from it. Regular screening guidelines say that at age 50, prostate screening should start. But for our higher population, which African American do fall into, screening actually begins between the age of 40 to 45. We do know that early detection yields better outcomes, so that's what our main focus should be. Also, flu vaccination. That's something that affects racial and minority groups at very, very high levels. After all, African Americans are less likely to get their flu vaccine, but are also more likely to be hospitalized with the flu. With that being said, during this COVID-19 ongoing pandemic that we're facing, it is more important ever than ever to please go get your flu vaccine. We need you to get that, and as soon as it's made available to you, also your COVID-19 vaccine as well. With that being said, build your relationship with your primary care. That relationship that you build is probably one of the most significant and most important relationships that you will ever build your entire lifetime. It can help build that essential gateway that you need to help navigate to a good, healthy lifestyle and overall improve outcomes and live longer lives. After all, the African American community, we need to get involved, stay involved in our health care, make changes in our own behaviors, follow up with our primary care. For more information, please check out our virtual website, check out our CDC link as well that provides you with more information. Let's stay involved, let's do it, and let's save lives. Thanks.